Within healthcare, there are multiple individuals involved in caring for a patient's health, mainly doctors, nurses, lab technicians, the patient themselves, and more. The number of conversations and types of communication that can take place between each of these individuals is quite large, and when combined with health technologies, that number increases. Due to this complex communication system, there is room for potential error through miscommunication. Thus, it is imperative that a good communication system be in place within the healthcare industry so that the best care available is given to the patient and they are satisfied with their care. Therefore, communication in the healthcare industry is a key part of its success, and miscommunications need to be reduced by further trainings for medical personnel and better use of new technologies. I recently had the opportunity to video an example of this communication system within a real doctor's office. I'm here at Old Farm OBGYN with Dr. Rapley, and we're gonna go through some of the points of communication that can happen in a doctor's office. So let's get going. When coming in for an appointment, the first place a patient goes is the waiting room. The first point of contact they will have is with the receptionist. The receptionist will have the patient fill out some forms with their information and then put those forms in the doctor's box. This is a point where miscommunication can easily occur if the receptionist puts the forms in the wrong box. This could lead to the patient waiting longer and becoming anxious or impatient. The medical assistant will then pick up the forms and call the patient to do some tests. But before those tests can happen, there's also two other points of communication that can occur. If there is surgery happening, the scheduling person will take care of scheduling that, and the office manager oversees all of the other communications in the office that day. The medical assistant will then lead the patient to do some tests. Those tests will include taking the patient's blood pressure, weight, and sending a urine sample into the lab. This is another important point of communication in the office. If there is a miscommunication, the incorrect test could be done and could lead to a misdiagnosis or will have to be done again. The patient is then led by the medical assistant into the exam room. The medical assistant continues the visit with asking the patient questions about her health and inputs that information into the patient's chart. If this were a first visit for the patient, she would first be led into the doctor's office instead of the exam room immediately. The doctor would then have a conversation with the patient and get to know her a bit. Dr. Rapley mentions here that it is extremely important for the doctor to actually talk to the patient and not to the computer screen. He explains that this betters the communication between doctor and patient immensely. The patient will then be asked by either the MA or the doctor to dress in a gown for the exam. Once the exam is completed, the doctor will once again talk with the patient. The doctor will again give his attention to the patient and not to the screen in front of him, as to help the patient feel important and at ease. The doctor will then put any new information into the EMR, the electronic medical record, which the patient may access herself. Any other prescriptions may also be sent electronically for the patient to go pick up at a pharmacy. To conclude her visit, the patient is then led up to the front desk once again to talk with the receptionist.
So here's again the last point of communication. At any point starting here, all the way around back to here, there's potential for miscommunication. And the most important thing is not to have miscommunication so that everybody knows what's going on with that patient. She then makes the appointment, gives you a little card, and says, "Have a nice day."